When you clean your room, do you just pick up a few things off the floor, or do you make sure you go the extra mile to make sure that your laundry's put away, that you dust, and that you make your bed? Your room doesn't actually get clean without cleaning everything in it. And the same thing goes with your teeth. If you brush, you can brush once a day, twice a day, but you have to make sure you go the extra mile, or else it's not going to actually get clean. And that's where flossing comes in. So flossing is just a simple act that can help prevent diseases and can keep your body healthy overall. The National Dental Association states that flossing can not only help your oral health, but can actually help your physical health as well. So today I'm going to be covering a few different things. So I'll be covering how flossing affects your health, the oral and the physical health, how the process works and how you do it properly, and what kind of substitutions you can do if you don't like flossing, and then the benefits and the consequences if you don't floss. So when it comes to your oral health, this is what happens. When you don't floss, it can cause many different diseases like gum disease, halitosis, and gingivitis. So a lot of you ask, what actually causes the disease? And what causes it is plaque. So plaque is a biofilm layer of organic matter that contains 500 plus bacterial species. So what happens is when you floss, the floss breaks up the plaque that is sitting in between your teeth and will help get rid of all the chances of getting those diseases. So when it comes to your physical health, this is how flossing comes in handy. So your mouth acts as an entryway to everything in your body. They have many different bacteria, microorganisms, and blood vessels. So the main thing you want to worry about are the blood vessels in your mouth. The blood vessels in your mouth are close to the surface, and when they're irritated, the pores will open, and when the pores open, it lets everything in, like the bacteria and the stuff that you don't want to have in your mouth. So if you don't floss, those blood vessels will become inflamed, and that bacteria that's already sitting in your teeth will go into those blood vessels. So the reason why that's such a bad thing is because your blood vessels connect everything to each other. It connects all of your organs together, like your heart, to your liver, to your kidney, to your lungs, everything. And it can start an unhealthy chain reaction, because instead of it just staying in the mouth, it goes everywhere else and can increase your chances of disease like by 100%. So another thing is that improper flossing has been linked to diabetes, stroke, cardiovascular disease, poor pregnancy outcomes, and even dementia. So how can you fix this problem? So the one thing that you need to know if you want to fix this problem at its source is how to properly floss. So I'm going to show you this video on how to properly floss.
Flossing is a critical part of caring for your smile, and most of us don't do it enough. That could be because we don't know the proper way to do it. Take a minute and follow these simple instructions. Take about 18 inches of floss and wind most of it around the middle finger of one hand. Take the rest and wind it around the other middle finger of the other hand. Pinch the floss between your thumbs and forefingers, leaving 1 to 2 inches in between. Gently guide floss between two teeth by using a zigzag motion. Do not snap the floss between your teeth. If the floss is hard to get between your teeth, ask your dentist or hygienist about the variety of floss holders or interdental cleaning devices that are available. When the floss reaches the gum line, curve it into a C shape around the side of the tooth. Slide floss up and down against the tooth surface and under the gum line. Repeat for each tooth, including the back side of your molars. Floss each tooth thoroughly with a clean section of floss. Flossing every day is one of the best ways to care for your smile. Find out more. Visit UnitedConcordia.com.
So that's how you properly floss. And if you were listening to the video, it states that there are other ways to floss. So some of those other substitutions include some of these. So one of the most famous substitute for flossing are water flossers. So water flossers look like the water spout that the dentists use to just put water in your mouth and help circulate everything back into one general area. You can buy them at pretty much any drugstore, and so what it does is that you put it in the crease in between your teeth, and there's usually a button where you push it and it just shoots water straight through the teeth, which will shoot the plaque out of the center of your teeth. There's also something called an interdental floss. So pretty much that's just the little gum picks that you can get at any drugstore, and you can use it just with one hand, so it might be easier for some people, and they're a lot thinner than floss, which is kind of hard to do. And you just take it and you just put it in and out through the teeth, and you want to make sure that you rinse it off before you use it again, because then you're just putting plaque back into your teeth. So I'm going to show you the benefits of flossing. So as you can see in the mouth right here, the gums reach all the way down in between each crevice of each tooth, and the gums are not inflamed. They're pink, they're light pink, which is what you want to see. Then down here you can see how even the bottom of the gums, which are the hardest and the most easy to get inflamed, how those ones are pink and they're really nice. So going over to the diagram, you want to make sure when you're looking at your teeth and looking towards your oral health, you want to make sure that it's pink, that the gum is firm and not like squishy, and you want to make sure that they don't bleed when you touch it, like with a toothbrush or when you use mouthwash. Sometimes the mouthwash can hurt. So let's look at the consequences of not flossing. So these are some of the consequences. As you can see in this mouth, you can tell that these people do not have good oral health. You can tell by the discoloration in the teeth. And it doesn't even matter about the shape of the teeth, or even if you have crooked teeth. If you have poor oral health, this is what's going to happen. As you can see, the gums are inflamed and they're really squishy. You can actually see that they're squishy because they're like a little bubble shape. And it doesn't reach down into the crevice of the teeth like it should. It goes and stays up, which will make it to where there's little gaps in between your teeth, which can actually make your teeth fall out. And as you can see over here, there's actually some discoloration in the top part of the gums. And this is something that has to be built up over a period of time. And you can see that there's purple, which means there's actually a higher chance of getting any kind of gum disease, and there's gingivitis with that. So let's compare the two. So right here, you can see a comparison between healthy and unhealthy gums. You can see how right here, the gums reach all the way down, and right here, how there's discoloration and how they're inflamed. You can also see it in this diagram, just the subtle difference between the two. So what you want to look for when you actually want to see if you have good oral health is something like this. So if there's no inflammation and it's this light pink color, that means you have really good oral health. If there's mild inflammation, which can usually happen if you bleach your teeth or if you brush too hard, that inflammation will happen just because you might be being too harsh on your teeth. So what you want to worry about is when there's mild inflammation around the entire cavity of the tooth. So that means there's a higher content of gingivitis in it. And then right here, these are the two worst. They have a lot of inflammation. There is a lot of pullback and receding gums. And the receding gums is actually usually what happens when your teeth are about to fall out. And you don't really want that to happen. So the best way to actually prevent any of this to happen is to floss and to make sure that you have a good oral health. Usually people would prefer if you floss, dentists would prefer if you flossed twice a day, but they would be happy if you floss once a day, because you can actually see it if you do or don't floss. So the conclusion for this is that I wanted to show you the benefits of flossing and the consequences if you don't floss. It's a super easy and super quick process that'll take less than 5 minutes each day, and it's something that's super cheap and super easy to prevent any diseases. Would you rather prefer to spend $3 on floss or thousands of dollars correcting the damage you have done to your mouth? It does more harm than good. It does more good than harm, and we want to make sure that our teeth don't fall out. Thank you. Do you have any questions? Yeah?
How much are those water flossers?
So if you just get the basic water flosser, they can be around $20. But if you want to get like the more high intense, where you can actually pick the speed of how the water comes out, they can be upwards of hundreds of dollars.
Cool.
Anything else? No.
We covered it all.